Let's fast forward to 5 years old here, and the ever so popular ADD, ADHD, hyperactivity, tantrums, misbehavior. Bridge this between sleep, optimal sleep, not just the hours you clock on the pillow, Dr. Brown, but optimal deep sleep. How does hygiene still apply here? How does, school apply, regular good diet and all these other things apply to the mood, behavior, executive function you referred to earlier?
in school age kids.
Yeah.
Children, just even with any age, whether it's young, school age, adult. I think one of the things we know is that sleep deprivation impacts the prefrontal cortex. So that will affect impulse control, decision making. Sleep deprivation affects emotion regulation by way of the amygdala. So it causes this almost like an overactivation of that amygdala, which
like
is
a trigger, easily triggered.
Exactly. Yeah. And so we may start to see impulsivity. We may start to see outbursts. We may start to see poor memory, right? We may start to see, again, poor executive function, poor decision making. And a lot of these symptoms mimic ADHD. Those are ADHD-like symptoms, right? You hear a lot about hyperactivity. They have a lot of emotional outbursts. They're impulsive. They have attention problems. They have memory problems in kids who have ADHD. But here we are in kids who have sleep deprivation, really having those same manifestations.
Exact same profile.
So this is what I always say, that if we have a child with ADHD-like symptoms, even on their pathway to this evaluation or diagnosis, to make sure we go by way of good sleep. Because addressing that
starts there.
Really, really can be really, low-hanging fruit. That's really, really where we can intervene very quickly.
It's great. In functional medicine, we have this saying, look for the root cause. Treat the root cause, not the symptom, but the root cause.
Yeah.
And, obviously sleep is at the first entry point.
Yeah.
And so in North America, and I've heard, I've read it in your book and I've heard you talk about it many times over, we're dealing with an obesity epidemic in young children, metabolic syndrome, they're carrying too much weight on them. And at least as it pertains to sleep, sleep architecture, or the ability to fall into deep sleep, there is a high propensity of children these days who are suffering from apnea. What is that? Talk to us a little bit about that, how to identify that in your child. Because again, we're painting the picture of this sort of child that goes to school now and they're maybe flat out falling asleep on their, let alone attention deficit, falling asleep on their desk in the worst case scenario. But at the very least, they're not as attentive or maybe not learning or memorizing as well as they should. How do we identify sleep apnea? How do we fix it?
Oh, yeah. So sleep apnea is grossly underdiagnosed in children, frankly, I think, as far as I'm concerned.
Yeah.
While we know that the prevalence is anywhere, like you mentioned, of 1 to 5%, it depends on what data we're looking at. The most common cause in children is enlarged tonsils and adenoids, which are tissues at the back of the throat and back of the nose. Sometimes now with craniofacial development, we're seeing that also plays a role. So how their faces are formed, the kind of diet they're eating, right? A lot of times now we're eating really soft diet, which does not promote.
We're not chewing.
We're not chewing. Everything's in purees, right? So this is impacting, the airway of that child. And so the symptoms we see is impacts the sleep quality and will affect their day. So you can imagine, this is how I describe it to parents. Your child is going to sleep. The tissues in the back of the throat are much relaxed. Now you have tonsils that are big, that are obstructing. It's going to affect the flow of air. What is in air? It's oxygen. So what does oxygen do? Everything. So every time they go through cycles of pauses, of snoring, they're really getting interruptions in oxygen flow. And so they wake up in the morning, they're unrefreshed. Their sleep quality, their sleep is fragmented. They may not necessarily be getting into deep sleep, because every time they get into like deep sleep or REM sleep, the brain's like, sorry, you gotta breathe.
I need oxygen.
So now we're going to see manifestations of that during the day. We're going to see tiredness or irritability or excessive sleepiness. And so this is really what I say. If you have a child that's snoring, you need to and they're having these daytime problems. If they have habitual snoring, because we have other reasons why kids might snore. They might snore if they're sick. They're congested a little bit, things like that. But outside of that, when they have habitual snoring, and they're having all these daytime effects, they should be evaluated. And typically the way we evaluate is with a sleep study. So a sleep study is what we call a multi-channel way of kind of assessing how much airflow they're getting, what their oxygen levels look like. And then based on that, we make a call. Do they have sleep apnea? If they have obstructive sleep apnea, how severe is it? That's what the sleep study helps us to tell. Is it mild? Is it moderate? Is it severe? And that kind of drives what the interventions will be.
Right. Yeah. And it's backing up their lymphatic system to, kind of full cycle to that, right? Yeah. If they're constantly waking up and oxygen saturation's poor, their brain is toxic. It's on fire. I want to move really quickly, though, from conventional traditional wisdom to the wisdom of naturopathic medicine. We talk about enlarged tonsils, enlarged adenoids, enlarged, signalers that basically are saying something is foreign in the body, not necessarily the environment or allergies. Yeah. What is it that parents can just sort of kick out of their kids' diet to start with that may have a significant enough impact that they could all of a sudden stop snoring? What are some of those things?
I mean, number one, always look at diet. Yeah. So start with the top allergens: dairy, wheat, soy, some fun eggs. So
sometimes eggs, yeah.
Gluten obviously is the other big one these days. So start with the diet. I always recommend, dairy products and gluten. Start with those two. They're the ones most likely most children can be sensitive or allergic to, which then starts affecting the lymphatics, the tonsils, the adenoids. Start there. I mean, in terms of counteracting anything that may be causing inflammation in the lymphatics, again, vitamin C is my favorite. In terms of helping the lymphatic system clear itself. But start with diet.
Allergies, Dr. Brown, typically have what you would refer to in your practice as a phenotype, right? The way a child may present. And one of the most common ones that at least I'm familiar with in my practice is the allergy shiner. Yes. When we're talking in context of food, but also environmental allergies, this presentation can often, and a mouth breather, right, can often signal that this child is also a snorer and therefore not having a very optimal sleep architecture.
Absolutely. Allergic rhinitis is one of the big reasons why children snore. And so sometimes, like you said, eliminating certain exposures, whether it's dietary, whether it's environmental, may actually be what they need. And I think that's just really important. And many parents just don't know. It's just, you just think my child just snores. Yeah. Snoring is not normal. It just triggers something must be done. And not every child, one of the treatments, especially if you have severe sleep apnea, is to get the tonsils and adenoids out. But how did they get there in the first place? Right. So sometimes really going back to that root cause. Now, of course, if they're trying to, die every time they go to sleep, well, we got to do something very drastic and emergent. Sure. But many times it's the mouth breathing, it's the, that allergic facies. That's something that's very, very easy to intervene on.